computer. Perfect. All right, so thank you again for joining us. The Hispanic Latino Employee Association has put together this event as part of Hispanic Heritage Month, but really just trying to get an understanding of the broader ODU community and the Hampton Roads to acknowledge the impact that COVID-19 has had on the Hispanic Latino community broadly across the United States, but then also specifically within the Hampton Roads. So the executive board thought that one of the best ways to do this was to host this kind of guest lecture to invite two great speakers to be able to speak at the national level and at the local level. So the way that I figured that this event would be structured is that, brief little introduction, and then I would introduce each of our speakers where they will be given an opportunity to give their presentation, and then we'll open up the floor for Q&A. So our first speaker is going to be Dr. Oswaldo Moreno. He is the Research Director of La Esperanza Research Program and the Co-Director of the Latinx Mental Health Clinic. He is also an Assistant Professor of Psychology at Virginia Commonwealth University. He earned his Bachelor's in Science and Psychology with a minor in Religious Studies from Arizona State University and an AMTS in Religion and Social Sciences from Harvard University, as well as an MA and PhD in Clinical Psychology from Clark University. So without further ado, please welcome Dr. Moreno to talk about the impact of COVID at the national level.
Thank you, Dr. Mecca. Alan and I met when towards the beginning of our Virginia trajectory. We moved down to this area roughly around the same year. So I am an assistant professor at VCU since 2017. So for about 3 years, I am slowly acclimating to be a Virginian. So it's getting there. I'm not there all the way, but thank you for having me. I am a first generation born Mexican. I was born in northern school. Also a first generation college student. My mom and dad we grew up in Arizona. My mom and dad were what we call in the literature a migrant farm working parents. Within the my dad in his younger years was really held on to the Cesar Chavez movement in the Yuma, Arizona area. So I'm gonna talk a little bit today about the COVID impact broadly defined and what some of the things that are going on here in the state. I'm going to talk as an academic scholar investigating the Latinx psychology literature, but I'm also going to talk as an active member, as an active Latino in the Latino community. So I can disclose that my family has been hit hard with COVID. My family, where I grew up with in the Phoenix, Arizona area, were at the center of the hotspots in the summer, where we have lost approximately about a dozen individuals in our community. Just last 2 weeks, we lost my grandpa to COVID. So for me, I'm gonna be speaking about what's the overall conceptual nature of how it's impacting the Latino community, but I also want to speak as an active family member, as an active Latino community member in the Latino community, and so forth, and as well as finish with the resilience piece in showing how the Latino community is moving, navigating, striving adelante in these times, and really celebrating our Hispanic heritage. So as we all know, the Spanish-speaking Latinx community is disproportionately being impacted by COVID-19 for a variety of reasons. pre-COVID, we already know that there's a lot of disparities within the Latino community in regards to academics, in regards to health, in regards to various other means with regarding systems. But once COVID came in, it really created the gap larger. So most COVID-19 related information primarily has been distributed in English. We know that the literature has documented mainly at the beginning of the COVID pandemic here in the States. We know that a lot of the information started coming out in English, which really impacted our Spanish speaking and linguistic enabling communities. As an example, in Richmond, Virginia, we're really navigating a Latino information group. And the goal is to really disseminate relevant Spanish-speaking information regarding COVID. However, one of my areas of critique to our group is that we're talking about October. COVID happened in February, March. We're talking about almost 6-7 months, and yet we don't establish relevant local, state level as much as we can. Yeah, there's stuff out there, but recent even reports are showing that the information that is being disseminated is really outdated information. So we know that COVID information, our knowledge of it is drastically changing, it's growing. And so the information that is being disseminated out to the communities is key, especially in a different language. So there's other reasons why the Spanish-speaking Latinx communities are one of the most vulnerable communities with COVID. First, we know that Spanish-speaking Latinx individuals may not have adequate access to healthcare services. Pre-COVID, we knew that. Post-COVID, it just really blew this up. It really augmented this. It really grew. And we know because of various levels. We know that at the systemic level, it could be a role of insurance. We know that at the community level, there's not a lot of clinics for our Spanish-speaking or our Latinx communities. We know that the provider level, we know that there's not a lot of providers like us. We know that there's not a lot of Latino providers out there, or in the language, or even just being culturally understanding the culture at the patient level. It may just be some attitudes. It may be stigma. It may be not knowing the information well, and as well the provider-patient interaction. So we know that Spanish-speaking Latinx individuals do not have access to healthcare services, period, especially in the state of Virginia. Yes, it's growing, but we're not growing at the same level as our Latinx communities here in the state. So right there is it's highlighting a health and healthcare disparity within our Latinx communities here in the states as well and the country. And now with COVID, we're seeing that it's really augmenting even more. We also know that a lot of the Latinx individuals, especially the Spanish-speaking Latinx individuals, are essential workers. They work in grocery stores, restaurants, custodian workers, agricultural positions, among other duties that are vital during this pandemic. So we know that while many of us have been impacted by being teaching remotely online, we're still, to a degree, have a sense of privilege where we are somewhat safe in our own spaces, where in order for these communities to gain the finances or moving forward, they're going into restaurants, they're going into grocery stores. They are the ones that are keeping our these settings clean or COVID-free, etc. So that's putting Spanish-speaking Latinx individuals more at risk for these COVID-19. We also know that Spanish-speaking Latinx communities are vulnerable since they are more likely to be underutilized or may not really know the how to get to these services. I've heard personally as a Latino family member and a Latino member of the community, es una gripa, nomás tómate, usa el vaporú, or using some of these self-remedies, right? Un tecito y se te va a quitar, o un pollito, un caldo calientito. So we've seen that, we've heard that. I mean, if I can just show, if you can just put a thumb up, if you know what vaporú is, right? That these are the remedies that one engages. So one is not really going into getting tested. One perhaps is still navigating, going out to do their day-to-day activities, being exposed, or even exposing others because of the systemic, but also the cultural nuances out there. So Spanish-speaking Latinx communities are especially vulnerable since they are more likely to be insured, as well as the cultural factors. We also know that Spanish-speaking Latinx individuals, or just the Latinx community in general, collectively have medical conditions. We know that there is diabetes. We know that it's high blood pressure. We know that asthma is higher than the general community. And so as we're continuing to learn about COVID, we know that some of these underlying medical conditions make individuals more vulnerable and susceptible to COVID. So these are contributing factors to COVID-19 complications. So on top of having to go out, on top of being essential workers, on top of the system not being at any level, not being in the Latino community's favor, there's these medical underlying conditions that are contributing to COVID-19. So, pues, ¿qué más puede pasar, right? Making these individuals, these communities more vulnerable. And recent reports note that the mortality rates for the Latinx and African Americans is outpacing that of other racial ethnic group when we're talking about COVID. I being from Arizona, hotspot. If some of you are from Florida, hotspot, or the South, Texas, hotspot. Qué coincidencia that a lot of we may be here in Virginia, but a lot of our networks, connections, or our ties have been a part of a hotspot or a or know someone who has had COVID or who has been impacted physically through a mortality, regarding COVID. And as a psychologist, we know that if there were already mental health disparities in this country within the Spanish-speaking Latinx community, they're only likely worsening now during this pandemic. We know that stress is an indicator for a lot of these health outcomes, and well, ni se diga, we all are encountering and experiencing stress. We know that negative life events, or with children, adverse childhood events all play a role in terms of outcomes. Y pues ni se diga how a lot of these negative life events are going on, are augmented stressors are increasing now. And so that only means that perhaps the prevalence rates are increasing. It only means that perhaps more not only on the physical, but also on the mental health. And there is more of a cry for intervention science to kick in, or somehow prevention science to come in, but in a way that it's culturally relevant and appropriate for these communities. But because it is Hispanic Heritage Month, and because I was given about 15 minutos and my 15 or so minutes are coming up, I also want to look at the other side of the coin. It is Hispanic Heritage Month. And one can argue, yes, our communities are being vulnerable, but at the same time, man, can we talk about those strengths? And so I would like to flip it a little and really honor our Latinx essential workers. I would like to, on Hispanic Heritage Month, I would like to honor them. Our Spanish-speaking essential workers, the ones that are cleaning our offices, the ones that are keeping right now playing a big role in our economy. Latinos living in the United States account for about 2/3 trillions in the economy activity. They play an active, crucial role in the economy, generally speaking, and now more than ever right now, as we have been in a recession, as we are all sheltered in our homes, as we are all in working from home. A lot of the Latinx essential workers are the ones that are keeping this going, the ones that are stocking up the grocery stores, the ones that are keeping clean, the ones that are allowing us to at least go to the drive-thru of restaurants, etc. So on Hispanic Heritage Month, I would like to honor our Latinx essential workers. I also want to honor our Spanish speaking and first generation parents on Hispanic Heritage Month. We imagine if we get tired, if we get stressed, if we get overwhelmed by being on Zoom or teaching students through this platform. Now imagine our Spanish-speaking first-gen parents who are navigating this pandemic, who are teaching, helping their children through virtual teaching in a language and in an academic curriculum they do not know and were not trained in. Man, that's resilience to me. I have some tias and tios, some aunts and uncles who it just amazes me, right? That they're navigating this. They're really pushing through. They're really striving for their kids' education to be of an importance and a priority in a language they may not know of, or in an academic curriculum they were not trained. So I do honor that them in the time that we are living in. And I also think on Hispanic Heritage Month we should focus on the resilience and on the heritage, because it does connect to that. And last but not least, I also want to honor and recognize those that we have lost in this process. Again, I've lost my abuelo in this process. I've lost my father 3 months ago through this process. I've lost some of my primos in Mexico through this process, some of my friends, childhood friends, their parents, etc. But Isabel Allende has a phenomenal quote on this that for me I have been holding true to that. La muerte no existe, la gente solo muere cuando lo olvidan. And I hold on to that. Is why? Because on Hispanic Heritage Month, we could continue to honor those that we have lost in the process, but recognizing that they're still alive in our families through our values of familismo, in shaping who we are, etc. I mean, as a Mexican, I mean, El Día de los Muertos is one good example. Even that movie, ¿cómo se llama? That movie with the dog, Coco? Is it Coco? A good example, right? Of la muerte no existe, la gente solo muere cuando lo olvidan, right? Knowing that during these times on Hispanic Heritage Month, even through this platform, we're saying, hey, we honor, we recognize, and we speak on the voices, we remember, and so todavía viven en nuestros corazones, en nuestras familias, etc., even during these times. And I conclude my talk on COVID-19 with this quote. My father used to say this a lot when we would be going through a lot, and to speak, I hold on to it and to speak on his behalf, that when things would get rough would be the levántate, suspira, sonríe, y sigue adelante. Si luchas por lo que quieres, tarde o temprano llegará. So even though we're going through challenging times of uncertainty, times where the Latinx Spanish-speaking communities are being impacted across the state in this country, as well as in our Latin American countries, we can hold on to this in being well, adelante, 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 luchar por lo que queremos, and eventually this too shall pass. So I leave you with those notes, and I open it up to any questions.
Thank you, Dr. Moreno. That was a great presentation. We're gonna switch to the next presentation, and we'll open up for questions to both of you, or both of our guest speakers today. So our next speaker is Dr. Elizabeth Torres. She is the founder and director of the Hispanic Resource Center of Coastal Virginia, as well as the vice president of the Hispanic Chambers of Coastal Virginia. She earned her PhD in political science from Duke University. So without further ado, Dr. Torres. You're muted.
That would help. Hello, everyone, and thank you for having me here on this presentation to speak about how COVID has affected our Hispanic community. The Hispanic Resource Center was a project that we were working to launch in possibly 2021, closest to the end of 2021, beginning of 2022. Due to COVID, we all kind of got pushed into getting this done a little bit more quicker than we had planned. So as we all know, Hispanics make up about 9% of Virginia's population. And with the COVID-19 cases, we were about 43%, which was the last statistic that we have on the COVID cases. So here at the resource level, there are a few things that we think that play a huge factor. You know, the lack of resources that there is. You know, a lot of our clients that come in, you know, do not know about the resources and the clinics and the other, you know, different organizations that can offer those assistance to them and be able to provide for their families. Updated information. A lot of the information that was out there wasn't information in their language, and it wasn't updated or correct information for that matter. And a lot of the families didn't know where they were able to get such information. And one thing that, you know, I question a lot of our, you know, clients here was what was their biggest challenge, you know, prior to the Hispanic Resource Center. And their number one answer was always communication, you know, that language barrier, and just having, you know, medical staff and resource centers and information that is able to speak and communicate with our community members goes a long way in knocking down those barriers. When they see people, that look like them and speak their language, it builds that trust, and it's what gets them to come out, and not have that fear. A lot of our, clients were, were still working, that were still in positions that were high risk positions, as the previous presenter had mentioned. And it was, one of those concerns, because they were required either to go to work or they couldn't financially afford not to go to work. So they were putting themselves and their families at risk continuously. In addition to that, not having health insurance, having fear to going to the emergency rooms or seeking medical attention, was causing them to say, oh, I'll just have a cold, or I'm just going to drink something, that's going to alleviate the immediate, symptoms that I have, and weren't really, taking those steps or knew where to go to be able to get that treatment. So in saying all of that, this is why we opened our doors. We wanted to be able to service and become the bridge between the Hispanic community and the resources that are already established here in Virginia, and be able to provide that bridge or that communication and that contact, to that community member, and being able to obtain the services that they need. So for us, equity is really about getting the individual what they need when they need it. And that's exactly what we do here at the Hispanic Resource Center. We service everyone, and we have absolutely, remember the first 30 days when we opened, we started, within 30 days, we had over 400 clients that had come in seeking assistance. As of today, we're well over the 1,200 mark of individuals that we service here at the center. So we continue to push through. We partnered up with different organizations such as Centara, United Way, to be able to assist and relieve a lot of the needs that these families are needing. We were conducting free COVID testings in different various places, not just here in Hampton, but as well as, the Virginia Beach, the Norfolk area, Newport News, to be able to make sure that we were getting the word out, get tested, come in, we're here for you. We have the services that you're needing. Please, reach out to us. So it was very wonderful to us to see a great group of people come out and have those COVID testings and feel confident and build that trust with us. Now we get a bunch of referrals and calls from them because we've been able to establish that trust and continue to service them and, different other issues that they possibly have. So that's who we are, and that's what we do here. And that's the end of my presentation.
Thank you very much. Let me, video would be helpful, right? Yeah, okay. Let's go back to gallery view. So at this moment, first of all, again, I want to thank our speakers. Thank you for taking time out of your schedules to come talk about COVID broadly, but also the phenomenal resources that are being provided by this new resource center, the Hispanic Resource Center. At this time, I'd like to open the floor up to questions. So if anyone has any questions for either of our speakers or both of our speakers, feel free to either write them in the chat box or unmute yourself and ask away. Should I come up with a question? That way we get the ball rolling or something. I feel like that's often the easiest approach. Okay, I guess. Oh, perfect.
Hi.
Louis, take me.
Yeah, that's the question. My question is for both of you. Is how long do you think it's going to take to get an awareness of what's going on with Hispanics in terms of COVID, or how the population or the Hispanic population is growing in the case of Virginia, until we actually have a like some sort of real weight in the state that would give that population enough leverage to not be like you were more or less talking about now, like living on the side of everything that's happening. And I'm not talking about it, that doesn't need to be something exactly like 2 years, 3 years. It's like, what do you think the process developing and going?
So here at the Resource Center, to answer that question, we're going to continue until that's how we and the directors here discuss that. Mm-hmm. We are going to continue our efforts by bringing awareness to different organizations, bringing awareness to these other different agencies to make sure that, you have those plugins for, the bilingual, where they can get on their website, and if they're looking for resources, they can hit that plugin and translate that website. We're going to continue pushing our efforts until we're able to get that awareness through the entire community of, being able to understand that we are here and our community needs you.
I'm wondering, so I'm thinking about this as kind of like Bronfenbrenner psychological systems, right? Is at what level are we talking about? Are we talking about it within our community? Are we talking about with our students, or who are we talking about it at the state level or even higher at the federal level? Because a lot of this is really distribution of resources, right? Even knowledge is a resource. And even implementation is a resource, right? And right now, it feels like the Hunger Games, where we're really fighting for the resource when it shouldn't be this way. So it really goes into policies, right? But policies don't really need to be at the state level, although they should, or at the federal level, although they should. So I'm wondering if whatever we're doing, right, it's with the aim to be able to have an impact, not just for right now, because COVID can pass, and yet we're still navigating the same issues. Even pre-COVID, we still had these issues, right? And so COVID will pass, yet, I hope, and yet we're still going to be navigating this. So it's, I would say that yes, it is on the knowledge of the dissemination of education, but it's also for us not to be kind of like it's at the policy level through like Latino advisory boards in the state of Virginia within the governor, or with committees, right? Wherever we're at, to be able to bring in actual policy lens frameworks through that. It's kind of like I always use this metaphor. So my mom and my dad, I disclosed, were farmers. My mom also cleaned offices, but she always used the example of, well, I'm cleaning the table so you could sit at the table. And I hold true to that, right? Where our former generations, for some of us, were really cleaning or serving the table so we can sit at the table. And because of our credentials, because of our positions or our affiliations, that allows us to sit at those tables to be able to bring the voice and the impact to those that were serving the table. So that's what I would say is it's not just about the research or just the engagement of the conversation, but really more concrete policies, whatever level that looks like.
And here at the Resource Center, like Dr. Moreno said here, COVID is just a phase. These problems existed way before COVID. COVID brought it more to light, right? So now that, we are here, we're established now, we're starting to do other things other than just deal with the COVID situation. We're working on our educational programs at this time. We partnered up with Hampton Roads University. We just got our contract last week to be able to provide tutoring for, students that, are falling either behind due to ESLs or IEPs, and can come to the center here and be able to get those services and teach the parents to navigate through those, online courses and educate them and be able to provide that resource and assistance to the families. But we're only able to do this when we partner up with other agencies. And the more we partner up, the more we get, the voice out, the more we engage our community and all of these other different entities here in the Virginia area, the more awareness we prompt.
Great. So we have a question. I don't know how much you'll be able to speak to this, but in the chat box from Linda, Linda asks, is the rate of COVID coming down now? I applaud Governor Northam's reaching out with his meeting with Spanish speakers. And I would extend that part also personally, and I wonder, was there more that could have been done to reach out to the Hispanic community in the state of Virginia?
Well, there's always more, right? You could always do more. So I can't speak on behalf of the rates, but what I can speak is in regards to what is being done throughout the state, including Richmond. Now, I know we've talked about Hampton's Roads, but in Richmond, there has been a precedence and boards to be able to even nurture or not nurture, really help Latino businesses or and so forward, or even just establish give free masks and so forward. Now, even if it were to be going down, we're about to enter into a flu season. So we don't know how that's going to impact. So I wish it was just like a mountain that you go up and then you go down, right? But that doesn't sound like this is the case. It sounds like it's more like a roller coaster. So I question, even like right now, maybe we are going on a down of a roller coaster. This is a time I would say my area of expertise, would be the time to really start thinking of prevention science. If folks have not been impacted yet, this is a time to really use the awareness to prevent, because it could come. The second wave can come. We don't have a vaccine yet. Until we don't have a vaccine, that means that we should be thinking of implementation science through the awareness, through ways to implement, but also the prevention science piece that I feel that needs to be being discussed, because yes, if it is going down, we don't know if it's going to stay down, and we should be talking about preventing it from going, or if it goes up, preventing it from impacting our Latino communities the way it has.
So back in May, on a national level, the death rate was 32.4 for the Latinos. As of October 7th, it has gone down to 21.3. So I hope that can answer that question.
Thank you very much. Does anyone have any other questions?
Can I ask one thing to Elizabeth about that? How do we know why that has gone down? Do we know what measures have made that go down, or is just like the number with a statement of how many people are?
That number comes directly from the CDC with no additional attached information.
Yeah, because I think that would be the interesting part to know. I mean, I'm glad about the numbers, but what I mean is saying that is because Hispanics have been doing something by themselves, or there's been something implemented to help them, or that would be the thing. Just telling that is saying, well, now we don't need to worry about it anymore because it's going down.
Right.
So it would put us back in the same situation we had before we started talking.
Yeah, I echo Luis, your point, right? Because I mean, we can look at it from a research lens, right? Is how are we measuring this? Knowing that, I mean, we don't want to get there as scientists, right? But CDC has been impacted a lot through a political agenda as well, right? In terms of storytelling. To a degree is what do we have that's an objective measurement that's telling an objective story about our communities? And right now, I myself would say, I don't think we have it. I don't think we know. That question that you're describing is such a valid and relevant question that we don't know. We may know at the micro level in terms of what we're doing as within our communities and so forth, but from different systemic levels, that remains unknown. And so there's still a lot of room of knowledge even within our own disciplines for our communities.
I would just add, as someone who was compulsively looking at waves and patterns, both within the Hampton Roads, within the Virginia, across the country, etc. That was my coping mechanism, which Cynthia thought was very, very grim and morbid. But looking at the patterns of transmission, if you look at the states that first got hit with COVID-19, there were states that typically have high populations of Hispanic Latinos. And then the second waves of states that got hit hard were other states that had high populations of Hispanic Latinos. At this point, from what I've seen in the last few data observations, it looks like COVID is starting to hit now more of the rural areas where Hispanic Latino populations aren't as prevalent. They're starting to hit more of, quote unquote, the red states, as the president has somehow made this a partisan issue nonetheless. But so I think that's one of the factors. New York clamped down, really took a lot of initiatives. Now the question is going to be with Florida opening up everything, as was recently occurred under the governor's new order. And with Texas, which has kind of had this back and forth middle ground approach, what is it going to look like in the next few months with flu season coming? I would take a guess based on what I've seen that those CDC numbers have changed are probably more of a result of geographical differences in how this pandemic has shifted around. But going back to Dr. Moreno's point, we really don't know, unfortunately. Okay, well, I want to, I guess, end it on one positive note. Just going back to what Dr. Moreno was saying about, this is, I don't want this event to be all negative, although it's important to acknowledge the problem. So what do you think has been an important lesson that we've learned out of the impact that COVID-19 has had on the Hispanic Latino community? What do you think might be the positive that comes out of this, if anything?
So to me, it would be being able to understand that we're here. There were, we were group, that minority, I as a Hispanic, we've had these issues before COVID. Now people are more aware of us, more aware that we're here, more aware that, we're part of your community. And I think that has been wonderful, everyone acknowledging us and being able to, understand, hey, okay, I hear you loud and clear, and I think that's a jump start,
I think for me, and forgive me, I'm a psychologist, so I would say mindfulness, being in the present moment. And I can recall this part when my father was passing. There was a lot of really good grant applications and a lot of calls for the line of work that we do. And being in the present moment made me realize, you know what, that can wait. Because right now I'm a son. Right now I'm a family member. So the value of like my familismo came out, like all these my values came out, and being like, you know what, that's what I'm going to hold on to the present moment. Even just being able to work from home, right? Like right now, ending this call and just being able to sit at lunch with my kids, as opposed to neglecting that time to being dot 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 dot. So I think for me, the big thing was just really being present and mindful of where I'm at, and what this means in regards to my value, dot, 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 and seeing how that's happening is beautiful. It's absolutely beautiful.
Well, thank you very much again for taking time out of your schedules to give your phenomenal presentations. We greatly appreciate it. Like I mentioned, this session has been recorded, and we will be making this recording public as soon as it's been uploaded and all that. I will share the link so that you all can feel free to share it widely on your social media platforms, etc. Thank you, everyone, the audience, for joining us. We hope that HLEA will have events like this more in the future to be able to provide more information about the Hispanic Latino community, not just specific to COVID, but more broadly as well. So if you are interested in learning more about HLEA, the Hispanic Latino Employee Association at ODU, feel free to send us an email at hlea@odu.edu. And if you're interested in becoming a member, feel free to reach out to us as well. We'd be happy to send you all the information. We accept community members as well as affiliated members. So we are open to all. Thank you, everyone, and have a great afternoon.
Thank you, too.